EMT Airway Master Audio Script, questions 1 to 25. Question 1. Rapid ascent to high altitude without proper acclimatization, may produce A. Pulmonary edema, B. Anaerobic metabolism, C. Thrombophlebitis, D. Pericarditis. Correct answer, A. Pulmonary edema. Rationale: acclimatization is the process of getting used to elevation over time. Without it, the body may develop fluid in the lungs. Question 2. A 74-year-old collapsed suddenly, is unresponsive, and gurgling sounds on inspiration are heard. The EMT should first A. Insert a nasopharyngeal airway, B. Suction their airway, C. Ventilate them with a BVM, D. Log roll them to the recovery position. Correct answer, B. Suction their airway. Rationale: gurgling indicates fluid in the upper airway. Immediate suctioning is required to clear the path for air. Question 3. A team is performing CPR on a 68-year-old. When ventilating this patient, the EMT assigned to the airway should A. Use a BVM that can refill in 3 seconds, B. Ventilate them once when CPR stops after 30 compressions, C. Use a 2-person ventilation technique, D. Ventilate them once with a BVM every 15 seconds. Correct answer, C. Use a 2-person ventilation technique. Rationale: this technique provides a better mask seal because one rescuer handles the mask while the other squeezes the bag. Question 4. The level of carbon dioxide in the blood is monitored by the A. Chemoreceptors, B. Lung parenchyma, C. Medulla, D. Respiratory rhythm center. Correct answer, A. Chemoreceptors. Rationale: chemoreceptors monitor blood chemistry, specifically levels of CO2a and pH. Question 5. A 30-month-old child has a fever of 102 degrees, cough, and shortness of breath. The EMT observes wheezes and crackles. The EMT should suspect A. Bronchiolitis, bronchiolitis, B. Epiglottitis, C. Asthma, D. Croup. Correct answer, A. Bronchiolitis. Rationale: this viral infection is common in toddlers and presents with fever and lower airway sounds like wheezing. Question 6. An unresponsive 26-year-old was shot in the right chest. Where should the EMT place their stethoscope to listen to breath sounds? A. Anterior on a mid-axillary line, B. Anterior over the suprasternal notch, C. Posterior below the scapula, D. Posterior below the clavicle. Correct answer, C. Posterior below the scapula, scapula. Rationale: listening below the shoulder blade on the back provides the best access to lung sounds without bone interference. Question 7. A 2-year-old patient was eating grapes and began to choke. The child is unresponsive and not breathing. The EMT should first A. Lift the child by the feet and perform back slaps, B. Inspect the airway and perform finger sweeps, C. Perform a series of abdominal thrusts, D. Begin chest compressions. Correct answer, D. Begin chest compressions. Rationale: compressions are the standard for an unresponsive choking victim to help force the object out. Question 8. Which of the following findings indicates a condition where air is trapped in the lower airways? A. Rales, B. Pleural rub, C. Wheezes, D. Ronchi. Correct answer, C. Wheezes. Rationale: wheezing is caused by air traveling through narrowed lower bronchioles, often trapping air in the alveoli. Question 9. What is the average minute volume of an adult at rest? A. 500 milliliters, B. 6,000 milliliters, C. 9,000 milliliters, D. 3,000 milliliters. Correct answer, B. 6,000 milliliters. Rationale: calculated by multiplying the average tidal volume, 500 milliliters, by a resting respiratory rate, 12 breaths per minute. Question 10. In order for a patient to progress to status asthmaticus, asthmaticus, they must A. Not improve with medications when suffering an acute attack. B. Continue to wheeze over lower lobes for over 2 hours. C. Continue to wheeze after being medicated and then become hypoxic. D. Not improve through regular use of prescribed medications for 2 months. Correct answer, A. Not improve with medications when suffering an acute attack. Rationale: status asthmaticus is a life-threatening, prolonged asthma attack that does not respond to standard treatment. Question 11. A 72-year-old is cyanotic with an SpO2 of 84% because their home oxygen failed. The EMT should first A. Determine the patient's resting SpO2 levels. B. Check the equipment connections for leaks. C. Assure the nasal cannula does not have a kink. D. Administer oxygen by non-rebreather mask. Correct answer, D. Administer oxygen by non-rebreather mask. Rationale: treat the patient's hypoxia immediately before troubleshooting mechanical equipment. Question 12. Relaxation of smooth muscles in asthma is influenced by A. Beta-Adrenergic medications. B. Glucocorticoids. C. Alpha-adrenergic medications. D. Anaphylactoids. Correct answer, A. Beta-adrenergic medications. Rationale: beta-2 agonists work directly to relax the bronchiole smooth muscles. Question 13. An alert 68-year-old with sudden shortness of breath and an SpO2 of 88% should receive A. Transport the patient supine with their legs elevated. B. Administer oxygen. C. Apply an AED and push the analyze rhythm button. D. Assist ventilation with a BVM. Correct answer, B. Administer oxygen. Rationale: the patient is hypoxic but alert and breathing on their own, making supplemental oxygen the correct choice. Question 14. When assessing respiratory functions in distress, the EMT should A. Estimate the alveolar ventilation. B. Assess for a pleural friction rub. C. Determine the respiratory rate. D. Be sure breath sounds are clear. Correct. Answer A. Estimate the alveolar ventilation. Rationale: alveolar ventilation is the only way to confirm if effective gas exchange is occurring in the lungs. Question 15. Which sound should cause the most concern in a victim rescued from a house fire? A. Gurgling. B. Hoarse voice. C. Crackles. D. Wheezes. Correct answer, B. Hoarse voice. Rationale: hoarseness indicates swelling of the larynx from heat, which can lead to rapid total airway closure. Question 16. A 25-year-old has sudden shortness of breath after soccer with diminished breath sounds over the right upper thorax. Suspect: A. Spontaneous pneumothorax. B. Pulmonary embolism. C. Pleuritis. D. Costochondritis. Correct answer, A. Spontaneous pneumothorax. Rationale: a collapsed lung occurring without trauma, common in young adults during physical exertion. Question 17. Which of the following causes a reduction of surface area between the alveoli and capillaries? A. Pleuritis. B. Pneumothorax. C. Emphysema. D. Cystic fibrosis. Correct. Answer C. Emphysema. Rationale: emphysema destroys the walls of the alveoli, drastically reducing the surface area available for gas exchange. Question 18. A 13-year-old remains short of breath and wheezing after using their own inhaler. The EMT should A. Titrate the patient's oxygen delivery to a SpO2 of 100%. B. Transport them routinely to the hospital. C. Ask the patient to demonstrate how they use the inhaler. D. Administer nebulized albuterol. Correct answer, D. Administer nebulized albuterol. Rationale: the patient needs a more effective dose of bronchodilator to treat continued respiratory distress. Question 19. Toxic gas inhalation leads to hypoxia when the substance produces A. Damage to the epithelium. B. Breakdown of cilia in the airway. C. irritation of the esophagus. D. Damage to the bronchial lining, which narrows the airway. Correct answer. D. Damage to the bronchial lining, which narrows the airway. Rationale. Damage to the airway lining causes swelling, which physically blocks air from reaching the lungs. Question 20. A 78-year-old smoker is unable to speak, cold and clammy with an SpO2 of 78%. The EMT should first, A. Assist the patient's ventilations with a BVM. B. Administer oxygen by non-rebreather mask. C. Increase the patient's home oxygen to 6 liters. D. Determine if the patient uses an inhaler. Correct answer. A. Assist the patient's ventilations with a BVM. Rationale. Being unable to speak and having shallow breathing are signs of respiratory failure requiring assisted ventilation. Question 21. An 8-year-old with asthma has an SpO2 of 94%. The EMT should expect to hear A. Crackles, B. Wheezes, C. Bronchovesicular, bronchovesicular sounds, D. Raunchy. Correct answer, B. Wheezes. Rationale. Wheezing is the hallmark sound of the narrowed bronchioles found in asthma patients. Question 22. A 26-year-old climber has crackles in the lower lobes and an SpO2 of 82%. The EMT should first, A. Assess them for signs of cerebral edema. B. Rapidly transport the patient to a decompression chamber. C. Administer oxygen by non-rebreather mask. D. Assist their ventilation with a BVM. Correct. Answer C. Administer oxygen by non-rebreather mask. Rationale. High-altitude pulmonary edema is treated first with high-flow oxygen. BVM is not indicated yet.
Question 23. A 71-year-old awoke suddenly with shortness of breath and an SpO2 of 91%. The EMT should first A. Ask the patient if they take nitroglycerin. B. Administer oxygen. C. Lay the patient flat and elevate their legs. D. Auscultate, auscultate their lungs for wheezes. Correct answer, B. Administer oxygen. Rationale. Immediate hypoxia must be addressed with oxygen. Question 24. A 2-year-old with a barking cough and inspiratory stridor, Stridor. The EMT should prepare for A. Airway obstruction. B. Respiratory arrest. C. Emesis. D. Sepsis. Correct answer, A. Airway obstruction. Rationale. Stridor indicates a partial upper airway blockage that can quickly become a full obstruction. Question 25. A 47-year-old complains of difficulty breathing and abdominal pain. The EMT should first A. Assess for dependent pitting edema. B. Determine the patient's oral intake for the past day. C. Determine the adequacy of the patient's alveolar ventilation. D. Auscultate the patient's bowel sounds. Correct. Answer. C. Determine the adequacy of the patient's alveolar ventilation. Rationale. Assessment of breathing takes priority over investigating secondary symptoms.